My favorite parts of being a family physician in this setting is that I get to work with a wide variety of people. Every appointment is different. We are serving populations that are mostly working class individuals, some with insurance, some without. My patient population has several challenges to asking questions. Some is cultural. They were raised in societies where there was a hierarchy, and so what the doctor said is correct, whether they understood it or whether it made sense to them or whether it was confusing. But regardless of how minor or common or obvious you think your question is, it isn't if you have it. I had a patient who I was ready to start a medication for her diabetes. Every appointment she'd say, well, I haven't started it yet, I haven't started it yet. I finally had a discussion with her and said, do you have concerns about what I'm asking you to do? And she said, well, doc, if I start this medicine, I'm going to lose my leg, right? And so it turns out what had happened to her, she had a family member who also had diabetes. And soon after being placed on medication for his diabetes, he had to have an amputation. Without the patient having asked me that question, I would have never known that that was the barrier to her starting the medication. I find that patients that really grasp the whys behind what we're recommending are the ones who then will proceed with that plan. And that all comes down to asking questions. So patients need to come forth with questions, and providers need to be open about asking their patients questions and asking their patients to ask questions. There shouldn't ever be a concern about asking your doctor a question. If you're willing to ask your hairstylist a question or your grocery store clerk a question, ask your doctor a question.